Nursing is an art, and if it is to be made an art, it requires an exclusive devotion, as hard a preparation as any painter or sculptor's work. For what is having to do with dead canvas, the dead marble, compared with having to do with the living body, the temple of God's Spirit? It is one of the fine arts. I had almost said the finest of fine arts. This was once said by the famous Florence Nightingale, best remembered for her work as a nurse during the Crimean War. I received this quote from a website known as My Nursing Career. Today, nursing makes up the largest medical profession, as nurses are needed in almost every medical setting. Because there is an extremely large variety of nursing areas or specialties, most nurses are able to change their focus in the field a number of times throughout their career to take advantage of the many opportunities available. One of these specialized areas is pediatric nursing, which is providing care for infants, children, and adolescents. My name is Molly Moore, and ever since I was a little girl, I've always wanted to be a nurse, specifically a pediatric nurse. Therefore, I wanted to research my future career and the steps needed to become a pediatric nurse. Through my research, I found that the first step was to become a registered nurse, or an RN. The next step is to take an internship where pediatrics is practiced, and the final step is to become certified. Alright, so a person can become a registered nurse either through a nursing school or a nursing program. Students interested in nursing school should apply to state-approved and accredited nursing schools. In order to enter nursing school, you must have a high school diploma. Nursing programs generally look for students with 2 to 4 years of math and science, 4 years of English, 1 to 2 years of health studies, and some foreign language and computer skills. Although having a loving, caring heart is important for prospective nursing students, it's also important to do well in school. Alice Tuninga, an experienced nurse currently in the area of dementia, says that grades are important because with a heart for loving people comes the responsibilities of knowing how to care and what to do in so many different situations. A nurse needs to be sure about the care or action being given, not just guessing. So moving on, to become a registered nurse, there are generally 3 main degree programs offered. The first is the Associate's Degree in Nursing, the ADN. Next is the Bachelor's of Science degree in nursing, the BSN, and then there's the Master's degree in nursing, the MSN. Out of those 3, the most recommended is the BSN, which is generally a 4-year program. As reported by the American Nurse Association, in 2005, 573 U.S. colleges and universities offered the BSN, or Advanced Nursing Program. After completing a nursing program, you must become licensed by taking the National Licensure Examination. Once you pass the National Licensure Examination, you are officially a registered nurse. So then the next step in becoming a pediatric nurse is to find work in either a hospital or some other facility where pediatrics is practiced to get some on-the-job training. This internship generally lasts for at least 3 months, and it's required before you can take the Certified Pediatric Nurse exam. Once you pass the Certified Pediatric Nurse exam, you are officially a pediatric nurse. Now I want to discuss advancing as a pediatric nurse. A nurse who wants to continue their education through a master's program can then become a pediatric nurse practitioner. According to an article printed in the Pediatric Scholarly Journal, there are over 5,000 providers and over 60 accredited training programs to become a pediatric nurse practitioner. To become a pediatric nurse practitioner, you must have a bachelor's degree in science along with at least 2 years of advanced education, as well as specialized or supervised clinical training. Master's degree is minimal. You also can get your doctorate degree in nursing, which is the most common. So to review the process of becoming a pediatric nurse, the first step is to become a registered nurse either through nursing school or some other nursing program. The next step is to take an internship where pediatrics is practiced for at least 3 years. And the final step is to become certified by passing the Certified Pediatric Nurse exam. Once you've completed these 3 steps, you always have the opportunity to advance by becoming a pediatric nurse practitioner. With so many varied and challenging positions and opportunities available for continual growth, as well as helping and comforting those who are sick and hurting, it is easy to see why nursing is one of the most rewarding and fulfilling professions out there, especially pediatric nursing, because you are able to serve those who are at their most vulnerable stages of development. Stop it.